Shyanika? You want to say anything, Lilith?
Hi, everyone. Hi, Shyanika. I'm Lilith, Admin Director for the USCT course.
Okay. Clarissa?
Hi, I'm a student actually, and I was referred by Professor Abel just to listen in.
Okay. Eduardo? I think I see you there. You want to introduce yourself? You'd have to get off mute, I think. Okay. Well, let's move ahead then, because there are more people joining, but I don't want to take time away from Shyanika's great presentation. I'd like to introduce her to those of you who don't know her. She's assistant professor at the University of Kentucky. Before that, she had been at the Schroeder Institute and had worked with David Abrams while he was there, and has also worked with Kurt Ribisel at UNC. Her Ph.D. is in health behavior. Yay, fits with our division and institute. And she's very, very active in SRNT and has, her work is really guided a lot by reducing health disparities and reaching health equity, especially in her tobacco interests that have to do with use, marketing at the point of sale, and policies. And today she's going to be talking about flavored tobacco regulations. She's been on several national advisory groups, including the very important NCIN's measurement group. A lot has been going on there. And she's also worked on the Surgeon General's report on health disparities. I find it very interesting that she's working on centering equity in the public health standard, which has been a challenge for all of us to wrap our minds around, all of the T course basically. She's also has been teaching, and while it may not be within the purview of the FDA and what we do, she's developed, her teaching has worked on developing and evaluating preventive interventions, which I think is really great for this. She's extremely well funded with several current R01 grants that she's either PI of, co-PI or co-investigator. And one of her newer ones is an R01 funded by NCI and local flavored policies to enhance equity in tobacco. In an earlier talk we had this morning, she recognizes the challenge in terms of looking at the entire tobacco product landscape and is concerned about what the implications are if one type of legislation comes through that differentially affects different types of groups. And since she's focused on health equity, that's what we're going to hear about. So welcome, Shyanika.
Thank you. Am I sharing the right screen? I'm not sure.
Yes.
Okay, do you see the full screen, not the presenter view? Okay, perfect.
Yes.
All right, well, thank you so much for that introduction. I'm going to talk a little bit about flavored tobacco regulations as a health equity policy. These are my co-authors on some of this work. This is from my R21 that I recently completed. Just note that one of our co-investigators on this is a FDA CTP employee, but this is not work that was done as part of his official duties. Other disclosures. And just to kind of give you a broad outline of the talk, tobacco regulatory science and health equity, I'll kind of touch on that a little bit. I'll talk about flavored tobacco as an example, about my research, and then hopefully we can have a good discussion. So as you all know, these are FDA's tobacco regulatory science priorities. My work tends to fit into behavior, marketing influences, and impact analysis of policies. And so I specifically try to look at all of these FDA and tobacco regulatory science priorities through a health equity lens. And so what I mean by that is that when we think about the overall effect on the population and whether something's appropriate for the protection of public health, we really need to also think about the impacts on priority populations, populations that have been most affected by tobacco-related health disparities. And those populations often are in the position that they're in because of tobacco industry marketing. So that's how kind of all of my interests go together. And so what we really need to think about is that if policies predominantly, work and bring down population prevalence, that's great. But if they don't affect vulnerable groups more strongly, then we're actually going to increase disparities. And so I think we really need to think about how do we structure policies, how do we structure interventions to make sure that those who have been left behind in tobacco control are not being further left behind as we're trying to move forward. So my research interests generally are in population health, are in tobacco control policies, and are in health inequities and health equity. And so I think flavored tobacco is a really good example of all of these topics, and it brings it together really well. And so flavored tobacco use is associated with tobacco initiation, progression to regular use, dual use, and poly tobacco use. And particularly when we think about menthol cigarettes, which are the most studied, flavored product, they've been associated with decreased quitting success, and that's despite quit intentions and quit attempts. Sorry about my dog. So in 2009, the federal law banned flavored cigarettes, but as we know, menthol was specifically left out of that policy. And so in the interim, there's been over 300 localities, local and state jurisdictions that have passed sales restrictions on flavored tobacco. And these policies now cover about 19% of the US population with some type of flavor restriction policy, even without a national policy in place. There has been now a national policy that focuses on flavored pod e-cigarette products, but it's a very limited policy when you think about the large, the large and growing types of flavored products that are available on the market. So right now we have any number of products that are available and that appeal to youth, that appeal to and that may make it harder to quit tobacco use. Additionally, across a broad range of studies, flavored tobacco use compared with non-flavored product use is more prevalent for a number of different populations, including youth and young adults, females versus males, including pregnant females, in communities of color, particularly African-American communities, among those of lower SES and education levels, among sexual and gender minority populations, and those with mental health comorbidities. And so in April of this year, this is something I've been working on for the past 10 years. I was very gratified to see FDA finally announcing that they were going to take action to ban menthol cigarettes and to ban flavored cigars. And what was also gratifying in that announcement was that they specifically call out that one of the reasons that they were taking that policy action was because of the disparities that are being experienced by communities of color, low-income populations, LGBTQ individuals who have been targeted with use of these products and have borne the brunt of the harms of these products. So, as I noted, when we think about policy enactment, implementation, we really need to consider the equity implications of these policies. And so policies like a menthol ban. And policies can affect population prevalence and bring down smoking rates overall without affecting vulnerable groups. And if those policies predominantly affect more advantaged groups, then we actually have the unintended consequence of increasing disparities, as I mentioned earlier. And so as we think about directing the ways in which these policies should be structured and organized, we really need to keep these groups firmly in mind so that we can have the best outcomes, which is that these policies more strongly affect these groups and we reduce disparities. And that's what I'm thinking of when I talk about centering equity in the public health standard. And so for this particular study that I'll talk about, which is for my R21, this is a little bit of an older study now, but it was started in 2017. We had a couple of questions. So given that flavored tobacco use is different than non-flavored use, that flavored tobacco product use is higher among vulnerable groups or certain populations, that flavored tobacco product restrictions vary widely. And so I forgot to mention earlier, but when you think about those 300 or so policies, they vary widely in terms of comprehensiveness. So some policies, like the ones you have in California, are very comprehensive. They cover all flavored products, they cover all flavors, and they have very few retailer exemptions. Other of these sales restrictions are much more limited. So they only affect one product class. They may actually exclude menthol flavoring. They may only include flavored e-cigarettes and not include flavored combustible products and menthol cigarettes. So there's a wide range of flavor restrictions. And those kinds of restrictions are likely to have different types of equity effects. In addition, marketing of flavored products are targeted to vulnerable groups. And so in African-American communities and in low-income communities, these products have been advertised more heavily, they're more widely available. And so having these kinds of restrictions on flavored tobacco can contribute to health equity, but there's a lot of questions on how exactly they should do that. So I apologize, my kids are coming home, so I apologize for any background noise. But so a couple of the different purposes of the study, we had 3 purposes. And so, keep an eye on these icons because we'll talk a little bit more about them. You'll see how I'm going through each of these different questions. So first, when we conducted this study, this was in the Washington, D.C. area prior to when they had a restriction on flavored tobacco. So they have a new restriction now, which has not yet been implemented, but at the time there wasn't one. So we wanted to see what kinds of disparities are there in flavored tobacco ads and displays by neighborhood characteristics. What kinds of disparities are there and who is exposed to tobacco marketing in real time? And then finally, does that increased exposure to advertising influence later tobacco use? Okay. So we started a study funded by the National Cancer Institute, a pilot study that looked at, that we call the TRACK study, so the Tobacco Real World Advertising Exposure Study. And with this study, we screened young adult non-tobacco users as baseline. So they were non-past 30-day users of any tobacco product. And they were 18 to 24 years old in the Washington, D.C. area. We were focused on the potential effects of flavor policies on tobacco initiation rather than on cessation. We did a baseline assessment enrolling 152 eligible participants. They conducted an ecological momentary assessment for 4 times a day on their phones. And we asked them about their exposure to real-time, real-world advertising, tobacco marketing, and their store visiting. Within 6 weeks of when they did their store visit, we sent data collectors to the stores that they had visited, and we took comprehensive photo surveillance of all the tobacco marketing inside and outside of the stores using camera glasses. So they reported 240 store visits, and there were 96 unique stores. So we only went to each unique store once. And after the EMA, we did a 2-week follow-up looking at advertising recall. And then we also did a 6-month follow-up assessing product use. And we had a 91% retention at the 6-month follow-up. So for the study, the first part of it, we were looking at disparities in flavored tobacco ads and displays by neighborhood. The key measures, these were basically from those store, from the photographic store audits. So these are kind of a more objective measure of what was in these different neighborhoods. And so what we looked at was we took these photos, they resulted in, from these camera glasses, we extracted all of the ads that were in the stores, every ad, every display that was in the store. And we had data collectors code those ads for whether they were flavored or non-flavored or potentially had both. And for those that had both, flavored and non-flavored products in them, we coded those as flavored because we were trying to get an overall sense of how much flavored tobacco marketing was in the communities. We did that overall, and then for cigarettes, cigars, smokeless, and e-cigarettes. We then looked at census tract demographics of where the stores were located. We looked at variables of African-American residents, Hispanic residents, percent of youth, and percent of households under poverty. So we did, because we had 96 stores, and it wasn't a random sample of stores, we actually used geospatial methods to predict the amount of tobacco marketing throughout the city if there was a store at that location based on generalized least squares regression. And that was weighted according to spatial covariance value through ordinary kriging. So the idea there is that from these, stores that were near each other would have a more similar tobacco environment because of local competition and because of similar customer base. And stores further away would have less impact on what kind of marketing there was in those stores. And then we can, from that predictive surface, we generated zonal statistics at the census tract level to calculate an average predicted amount of marketing for each census tract. And we created those estimates for overall, flavored, non-flavored, and for each product and flavor category. Then we linked that to the neighborhood level demographics, and we assessed that at 10 unit changes, 10% changes through a linear regression. So the overall and product specific marketing in the visited stores, on average, there was about 19 ads and displays in the stores that we visited. About 10.6 of those were flavored, 8.5 were non-flavored. And most of those ads were for either cigarettes or cigars, with many fewer for e-cigarettes or smokeless tobacco. And again, keep in mind that we were coding specifically not for product availability, but for advertising. And so this is the results of our predictive geospatial prediction. And so in panel A here, it's a little bit small, but you can see that this is just a map of Washington, DC. And the deeper colors are greater African-American neighborhoods. And then these percentages are the ward level smoking rates. So you see that ward level smoking rates correspond very strongly with places with more African-American residents in DC. And if you know DC, this is the Anacostia River. These are the areas on the in Anacostia that are very low income and predominantly African-American neighborhoods. So when we did the geospatial prediction models, we found that the amount of predicted flavored tobacco product marketing pretty much mapped to those same neighborhoods that you see here. And these neighborhoods up here, where there is very, very little flavored tobacco marketing. When you look at non-flavored products, however, there was really no differences in the amount of non-flavor product marketing throughout DC. So if you go to a store up here, you would still find cigarette ads or whatever else, but you wouldn't see that excess amount of flavored product ads. Okay. And then when we looked by product, what we found was that, a lot of the advertising for cigarettes, as I mentioned, was very, this is actually for menthol cigarettes, which is surprising because normally, we tend to find more menthol cigarettes in African-American neighborhoods, but in DC, which is a predominantly African-American city, we actually didn't see that concentration of cigarette marketing, menthol cigarette marketing. But what we did see was excess flavored cigar marketing. For smokeless tobacco, we saw there was much fewer ads, but this was actually more concentrated in communities, and these were more around college campuses. So it was kind of an unusual finding. We were surprised by that. E-cigarette marketing was relatively low and was fairly evenly distributed. We didn't find any differences in non-flavor marketing for any product. Okay, so when we did the regressions, we found that, as you might imagine, overall there was more for every 10% increase in African-American residents in the neighborhood. The number of there was predicted to be 0.6 more flavored ads and displays, while holding all these other variables constant. But we didn't actually find that was related to poverty. It seemed more like it was related to targeting of African-American neighborhoods. For cigars, we specifically found that increase for African-American neighborhoods. And this paper, while for Hispanic residents, which are less concentrated in DC, there was actually less marketing. We did find more smokeless tobacco marketing, but I think, again, that might have been a function of the fact that Hispanics in DC are not as concentrated. And so we may have been also picking up marketing in more white neighborhoods. Okay, so for our EMA study, this is looking at disparities in who is exposed to tobacco marketing in real time. We found that the key variables were really looking at our real-time advertising exposure. So this is their self-reported exposure, when we ping them at random time, four random times a day for 2 weeks. And then we looked at a variety of different covariates. And this paper, so the prior paper was just published in NTR as early. This paper was led by Julia Sankey Chen, and I was the senior author. And this was just published in the Annals of Behavioral Medicine. So some of our covariates was like whether they lived in these wards of 5, 7, and 8 that had those high smoking rates, the lowest median household income, and had very high African-American residents. And the reason we picked those as kind of our quote unquote vulnerable community was because those are the communities that have historically been targeted with flavored tobacco marketing. And then we also looked at their current location during the assessment. And then we looked at whether there were anyone using tobacco in view. And so looking at sort of the social environment, and then we looked at individual demographics. So in terms of our outcomes, we just looked at the odds of exposure to any or flavored tobacco marketing, apologize. And then our multi-level model looked at observations clustered within individuals, since we had that nested data. And so what we found most strongly was that those who lived in our 3 vulnerable communities were more likely to report exposure to tobacco marketing in real time. And that was over and above their own individual characteristics. And so the effect of exposure to flavored tobacco marketing was even stronger. And these young adults, keep in mind, were non-tobacco users at baseline. And so they weren't being exposed because they were, going to retailers to buy tobacco. They were just going about their daily lives. And so they were also more likely to be exposed at stores, which, you might expect, or outside than at home. And so those kind of give you some potential avenues for where restrictions or policies might be useful. Also, about 40% of our participants reported at least one tobacco marketing exposure, and they recorded 94 exposure moments. So among all of our participants, about 30% reported, 40% reported seeing tobacco marketing, and 30% reported seeing flavored marketing at least once during their 2-week assessment. Okay. And then finally, we looked at, does ad exposure influence later tobacco use? And so this is a study we're still working on. So we're working to write this part up. But I had presented it at SRNT last year. So we've been a little slow. So we had a number of ways of measuring tobacco marketing exposure. Some of these, I really credit to Jennifer Unger and some of the work that she's done on looking at how we thought about these different measures. And so we had, real world, quote unquote, objective measures about their store visiting frequency in that 2-week period. We looked at the amount of advertising that was in the stores that they visited during the EMA period, linked to our measures of the store audit data. And then we looked at whether they reported seeing advertising 1 or more times during the EMA period. So these are all kind of more real world measures. Then we also had looked at self-reported measures. So we had baseline self-reported frequency of store visiting to convenience stores, liquor stores, or small markets, which is the measure that Lisa Hendrickson has used in some of her work. We looked at the pervasiveness of advertising and looking at baseline frequency of seeing ads in the stores of sometimes or often. And then we looked at after the EMA period, we looked at their self-reported recalled noticing of advertisements. So we tried to kind of match up these different types of measures. And so what we found was that our outcomes were really their odds of any tobacco use. We just didn't have a lot of use at 6 months of individual products. And we just did a logistic regression. So when we kind of put everything into the model, what we found was that in our unadjusted analyses, all of our measures were in the positive direction, but store visiting frequency measures, both subjective and objective, were most strongly correlated with later tobacco use. And in our adjusted analyses, these were particularly true for their baseline self-reported store visiting frequency, which was a little bit disappointing because we had done all of this real world work, and then their self-reported measure ended up being the strongest predictor. But our conclusions, I think, overall from all of these studies are that overall in flavored advertising, is more common in African-American neighborhoods. So that's not a new finding, but that non-flavor, that's not because there's less non-flavor marketing in other communities. It's really, there's more flavor marketing. That cigar advertising is particularly prevalent in these neighborhoods, that non-flavored tobacco marketing is evenly distributed across all of these neighborhoods. So the tobacco industry, is going to target you at anywhere you live. And then living in these neighborhoods is associated with any and flavor marketing exposure over and above people's individual characteristics. And then their retails and outdoor locations were most strongly associated with tobacco marketing exposure, and exposure through store visiting frequency, especially measured, subjectively, was most strongly associated with later tobacco use. So we conclude that, that excess amount of tobacco marketing in minoritized community is really driven by excess flavor marketing in those retail locations. And that is inherently unfair because these products are, have more appeal, they're harder to quit, they're easier to start. So policies regulating cigar marketing also can have a large impact, and particularly for flavored cigars in African-American neighborhoods. Young adult non-tobacco users, especially frequent store visitors, are at risk of tobacco marketing exposure and later tobacco use. So we need to think about ways to reduce their marketing exposure. And flavor bans can be potentially a way to help reduce that advertising availability and exposure and help reduce tobacco use disparities. So when we think about, how to really get at equitable impact of policies, we have to think throughout the policy process. And so I have a new study that we mentioned, a new NCI R01 that's called Local Flavor Policies to Enhance Equity in Tobacco. And that grant will be really looking at how different policies at different levels of comprehensiveness affect equity in different communities that have these policies. And so, you can apply the same framework to other FDA policies. So graphic warning labels, modified risk tobacco products, nicotine reduction. And we really need to think about, how are we trying to center equity in these policies. And then finally, some of the work we did, we submitted a public comment to, which I'm sure you all do as well, to the FDA docket on the pre-market tobacco, whatever it's called, the PMTA process. And in the final rule for the PMTA process, one of the things we were concerned about in our comment was that there was nothing in the preliminary rule that really focused on centering equity. And so we, in response to our comment, the FDA responded that they had revised the rule to emphasize the importance of considering the effect of marketing a new tobacco product on vulnerable populations specifically. They defined vulnerable populations, and that as one of the things that could be reported as part of a PMTA application was looking at demographic characteristics to clarify how different products might be influencing different populations. So I think thinking about equity throughout FDA policies is really critical, and I was glad to see this response to the PMTA process. So happy to take any questions.
You might have some in the chat. Actually, we had somebody point out early on that that there are several tobacco projects going on at the state level and coordinating centers for tobacco-free California. So I wanted to acknowledge that. That was a lovely presentation and very, very clear and very targeted, I think, to the FDA. And, you had expressed earlier, and we had talked about, certainly we would like that for people to think about ways that we can collaborate together, the USCT Court and what you're doing, because I think our interests are very aligned across basically all of our projects and what we're about. So if Jennifer and Steve are on the line, Either one of you might have questions about going forward, looking at marketing, on-site marketing, and at the point of sale, and see what new ideas you've been thinking about in terms of pursuing in future research.
Hi, Shyanika, really good to see you. I don't have a question right now, but I just wanted to thank you for this excellent presentation. But
Thank
Steve has
you.
a question, right?
No, I want to thank you as well for the presentation. I thought your studies are, quite amazing. Making use of both EMA and geographical, GIS related kinds of measures. We haven't done that, in Project 2, and so I hope we have the opportunity to work with you on that. Could you comment a little bit on, you mentioned that a strong predictor was self-reports, and could you elaborate a little bit more on what you think that means?
Sure. So, in the 2-week EMA period, right, we were only capturing kind of a snapshot of their store visiting behavior. We hoped that, we asked them to not deviate from, their current, whatever they were normally would do. But still, it was just a snapshot. So when people report in their self-report about how frequently they, typically visit stores, that seemed to actually be a better way to get at that store visiting, at least in that piece of it. I think part of it too was just that we had relatively few, we didn't have as much power as we would have liked. And so some of the maybe more subtle influences from these measures were harder to capture with our data.
Do you find that the self-report, that other types of measures are converging with self-reports? In other words, we always assume there's demand effects with self-reports, and it would be nice to know that we've got some validation of those self-reports through other types of measures.
Yeah, I think, like I said, everything was in the right direction, in the direction you would expect. So that was good to see. There was, and actually all of the measures were pretty highly correlated. So when we put them all in the model, we probably had some multicollinearity as well, because it was like 0.56. I think this is where we've been struggling a little bit about how to write this up, because it's like, are we doing this, exactly the right way? Because, all these measures were kind of correlated. So it might be better to potentially, use more of a structural equation model or some kind of measure that would, because I think we are getting at the same underlying construct, latent construct, and we've just measured it in different ways.
I wonder if there's a way in structural equation modeling to treat different types of measurement as indices on a larger latent construct that represents exposure to marketing, for example. I haven't done that particular way of looking at it, but it might be interesting, rather than making a choice of either or between measures, if two or more are highly correlated.
Yeah,
just a thought.
That's where we're trying to go. That's what we're sort of playing with in our heads, and I'm not a structural equation modeling expert, so that's where we've gotten a little bit stuck on this project, but we're trying to think it through and find good collaborators there.
I had a question about your the sequence that you presented before, and something struck me about you started out with non-users at the beginning, right? Mm-hmm. And you have people who have both reported exposure and recall of exposure to marketing, which was pretty high, I think. Mm-hmm. And I wonder if going forward, that represents potentially the importance of staging counteractive messages at the point of retail. And so rather than distracting someone from the message they see, if they see a message and recall it, let's say an ad that very close to that, is a counteractive message. And
Yeah.
I can't say right now what that would be, but it would be something to the point of, well, you know, the industry advertises a lot, just think about it. You know, that's what the state of California did years ago under contract. And basically it worked with young adults and adolescents, particularly with young adults. And it made people be aware every time there was a consideration of a product, whether it was a lower price or some kind of advertisement about it, and sending out messages that focused on the idea, well, tobacco industry is a big industry and this is what they do. And it made people really think and question about what they were being exposed to and what that meant.
Yeah, I think that's a good direction for this. We actually did also measure counter marketing influences the same way, and we put that in to SR&T for this year. So we so at least we would see, you know, what counter marketing messages they had received in this time period. But I think you're right that there is a possibility to kind of use the same methodology for ecological momentary, you know, intervention as well, and try and counteract that point of sale messaging, particularly because we know that the tobacco industry, you know, uses these geospatial, you know, triggers, for like coupons and things like that. So for a smoker that's trying to quit, they have the Marlboro app on their phone, they come in contact with a store and it pops up a coupon for them, which could undermine a quit attempt. So, you know, there's probably ways to do it that we'd have to think through.
Yeah, I think it's a very creative direction to go into. And your work before with Kurt, and I know some of his work had been working on retail stores, sort of simulating store conditions. And I think Jessica's on the line here, Barrington Trimus. She's interested in that. Sort of modeling what a typical store would be like and what would be in it, and how we can adjust that more towards tobacco control efforts.
Right. Yeah, and we did do a paper on whether, with Kurt, on whether graphic warning labels would offer an opportunity to kind of shift stores in a more healthy direction. Obviously, that was not prescient, given how long it's taken to have that policy, you know, passed. But I think that's another one where it would change the look and feel of stores if we actually ever got graphic warnings, and it could be an opportunity.
So we've got a couple things in the chat. Did you want to say something here about targeting marketing?
Hi, I was just wondering if you have any policy recommendations regarding just the targeted marketing. I mean, I think there's so much evidence showing that it makes an impact, but I'm just wondering if you know of any jurisdictions or, you know, that have, I think I have heard that it's difficult because of like public speech, or what is it called, freedom of speech laws or things like that. But I'm just wondering if you have any recommendations or any thoughts on that.
Sure. Yeah. I mean, I think one of the things with marketing is that, you know, at least in the US, that corporations have these free speech rights. So when you try to actually specifically restrict tobacco marketing, you run into First Amendment issues very quickly. So the other approach potentially is, like you say, either to try and restrict all advertising through sign laws. But usually the communities that have those kinds of policies are local policies, are higher income, you know, more affluent communities that don't have that exterior marketing in place. So those kinds of policies end up, unfortunately, tending to, just because of where they have been implemented and who likes their stores a certain way, is to have disparity producing effects. But I think a policy that has better effect is ones that actually would control products. And so product standards. And so having fewer flavored products, we're looking at this, but some of the preliminary work in jurisdictions that have flavored tobacco products restrictions is that it actually reduces the amount of marketing for flavored tobacco products. So that's one. The second is retailer density policies. So if you have fewer retailers in a community, you grandfather out, like you can't have retailers within 500, whatever of another retailer. That will actually reduce density overall. And so that through tobacco retailer licensing, that will reduce the total amount of advertising in communities. That may not, totally restrict an individual's exposure, but at least, for the overall community, it should have impacts.
You had, I have a question, and it sounds probably someone has studied this already. If you had the possibility that people living in some communities are exposed or subject to both a state policy that was enacted at a similar point in time and a local policy on flavors, against flavors, which do you think would be more impactful on an individual user of flavored products?
I mean, if the policies were equally comprehensive, then presumably the state policy would have more of an impact because you wouldn't have the border effects that you would have in a local policy. So, in a place like DC, it's actually a little bit harder because DC is, you have to cross bridges and whatnot to get to border communities to purchase tobacco. But in many communities, the next town over is not very far and people go back and forth all the time. So if the local, and I think even in LA County, right, there's flavor policy, but then the city didn't have it or did have it or whatever. So now that's being changed. And so I think local policies provide, the reason to have local policies is to start increasing the distance and reducing the availability of these products in communities. That will have a local level effect for people, especially people who are making a quit attempt, or who are just not seeing it as much in their local community. But but if the state policy is weaker than the local policies, then you're better off having a local policy than having a weak state policy.
Yeah, that was just raised in the chat. That was partially what was behind my question.
Mm-hmm.
And another one is, I know we're studying it. I don't think we have a final say on it, but the question stands if both state and local regions have a ban on flavored products. Is it turning young people and young adults at least to just purchasing things online from other places? And
there will always be substitution, right? I mean, you don't have, there's not a perfect thing in a very complex marketplace. But I think the bigger piece there is not that users couldn't get their products some other way. It's that it's that non-users are not, seeing it all of the time. And they're less likely to become users as a result. Also for users too, from a behavioral economic standpoint, you're making it, you're increasing the unit price. You're making it that much harder. You have to wait longer. You can't make those snap decisions. And so that will have effects on the population level, even if at the individual level, there's still going to be substitution.
I agree. Any more questions?
But yeah, I mean, in general, we try to like advocate, with my advocacy hat on, that local communities should continue to pass policies. They shouldn't wait for FDA. They should make them as strong as they can locally and with as few loopholes as possible. And we're actually, going to specifically be looking at that issue as well and providing guidance to localities through the new project that Cameron's a co-investigator on.
We've looked at some data that at first glance would suggest that there's more of a tobacco use problem in localities where flavor bans have gone into effect. But I think what that is too short a period of time to take a look at the impact and perhaps what happens at the local level if those ordinances are passed first or early compared to other places. It's because they had a bad problem to begin with.
Right.
So, we either need to start using extended baseline designs to help correct for that if we know far enough in advance when localities are going to put a ban into effect, or acknowledge that they might have been at higher risk to begin with, which is why they passed the bans. And we need a longer period of time to take a look at the impact.
Yeah, and there's actually relatively few evaluations at this point in the US on these local policies. So we're trying to, also work to expand that literature because some of the better data, right now is coming out of Canada with their menthol ban. And that's at a national policy level. So I think we're going to start to see more evidence from these local policies emerging. It's just, it is early days.
I didn't see any other questions. Do you want to talk a little bit in the few minutes we have about the work that you know of ours in potential areas of collaboration?
Sure. I think a lot of the store, audit work that you all do is really, really very much aligned with the work that I do as well. I use a lot of different store audit methods, and you have more, more diverse communities than I have access to currently. So I think, some of the work that Steve is doing in those areas is really interesting. I have another sideline that I do social media research. I know I've done work with Sherry Emery's group for a number of years. I'm a consultant on a Costa Gina's grant on smokeless tobacco marketing online. So that's another area that I have interest with, with what Jen Unger is doing and other of your T-Cores. I also do, a fair amount of work with, population studies like PATH or, the Truth Longitudinal cohort. And so a lot of your cohort studies are, are also interesting and really resonate with me because those data sources are just so so critical to look at those changes over time, especially because the marketplace has changed so much. The product landscape is really different than it was, even a few years ago. And so having more recent data, is useful, and seeing those changes is really important.
I think you're right. And I seem to recall from the TRS conference recently that there was discussion about the importance of having good cohorts to follow and designs that would continue in that way. So I think you're right on with that. Okay, we're just about ready to end. And anybody else have a question before we close out? Do you have any more meetings that you have today?
I think I'm meeting with Steve and Lorna later.
Right after. Okay, so you need some time to breathe, I think. Okay. Thank you for a wonderful presentation. I think everybody, let's see, someone asked if it's possible to receive the recording. Yes. Do you approve of that?
Yeah, that's fine.
Okay, good. Good thing nobody said anything adverse during. All right, thank you.
Thank you all for
everyone.
having me. I appreciate it.
Thank you.